The holiday season means more gatherings with family and friends. And with all the fun comes new challenges for your kids' health. So, here with tips as we head into the most wonderful time of the year, and also, the sickest time of the year, is Dr. Vanitha Mupin from WellSpan Family and Pediatric Medicine at Rossville. Good morning, and thanks so much for being with us.
Good morning.
All right, so this time of year, you make all the plans, you're doing all of these events, they're indoors.
Yes.
And it's a very quick way to spread a virus from one person to another. So what tips do you have to try to keep everyone healthy?
Right. So, if someone's sick at home, don't just chalk it up to allergies, just stay home. It's always safest if there's a question just to stay home to keep yourself, feeling better and also not spreading what you have. And if you see someone that's sick, kind of stay away and don't shake hands, don't hug, all the usual methods of transmission of these bugs.
Yeah, we've had, since my son was born, we have missed at least one holiday a year from him being sick. So my tip is to always have backup food at your house.
Yes, that's
just in case. All right. So, but how do you know when your kid is too sick? Us, we can kind of sense it. But, some kids, they can have runny noses from, August through May. So how do you know when they're too sick?
So definitely if they have a fever, anything above 100.4, please, please, please stay home. If the cough is getting worse, if they have other symptoms like vomiting, diarrhea, please don't be like, oh, we'll just go there and drink some soup or something. That's just not going to work. You're definitely going to pass something on. So, if anything is out of the ordinary, like runny noses for weeks and stuff is fine. But if you have a worsening cough, if you have fever, if you have any of the GI symptoms, just stay home.
Absolutely. All right. So then usually between Thanksgiving and the December holidays, kids go back to school.
Yes.
Is that the likely time where after they see the family, they go back to school, spread it to all their friends, that it's kind of those later December holidays is when you really got to watch out for?
You do both, because right now we're going into RSV and flu season. We do have quite a number of walking pneumonia cases as well. So, it's pretty significant right now going into Thanksgiving as well. But yes, definitely Christmas and New Year's is another big one. And then we see that when we come back in January after school starts again.
Getting outside, getting some fresh air and exercise, can that help at all?
Yes, most definitely. Like opening up those windows if you can. Like some of the days that we have right now are unseasonably warm. Open it up and air out your house and go out and get some fresh air. It's always a good idea.
Any other tips that you have as we head into the holidays?
Just, with the time change and stuff, kids' sleep schedules are off. Just, make sure you have a routine, decrease that electronics time, try and keep as much of a schedule as you can, because that sleep is really important in terms of staying healthy. It's a big part.
Yeah, not only for the kids, but for the parents too.
Yes.
That hour change,
yes.
Even when you think you're getting an extra hour, if you're a parent, you're not.
Yeah.
You're not.
Right.
You're losing a lot somewhere.
Right.
All right. Well, if your child needs to be seen by a doctor at WellSpan, we have information on how you can make an appointment. It's on fox43.com. Dr. Mupin, thank you so much, as always, for being with us.
Of course.